Today I'm going to show you the setup for the Alaris pump for thrombolysis. When you set up the patient for thrombolysis, you will use special pump tubing, and the pump tubing is the low sorb tubing. There won't be any lure locks on here, so it will prevent any bubbles from going into the patient, and this is the tubing that you will use. Next, I'm going to show you how to use the pump. First of all, what you're going to do is turn the pump on. Then it will ask you a couple of questions. It asks new patient. You're going to press yes. And then it will ask you what floor you're on. You want to pick critical care, so we're going to put yes. It will ask you for a patient ID. You do not need that. You can just press confirm. With thrombolysis, if you are doing two extremities, a right and a left extremity, you will have two pumps for each one. One will have the cath sheath heparin, and the other one will have the alteplase going through it. So if you have both the extremities, you will have 4 total pumps. If you're only doing one side, you'll only have 2 channels. First, what we're going to do is I will show you how to set up the cath sheath heparin. What you will do is press channel select, and then we're going to do the cath sheath heparin. So we're going to press guardrails IV fluids, and then what you'll select is go to A to E, and then you're going to press C for cath sheath heparin, and that will come up right here. You'll press the button for cath sheath heparin. This was selected. Is this correct? You're going to put yes. And then you're going to put the rate. Usually it's per the doctor's orders. Usually they do 30 mLs an hour. So we'll press 30. And then the volume to be infused. We'll use the pre-made cath sheath heparin, which is 1,000 units and 500 cc's. So I usually write 450 cc's. And then start. Next, what we're going to do, I'm going to turn off this channel. Turn this back on again. New patient, yes. Critical care, we're going to hit yes again, and then confirm. Next, we're going to set up for the alteplase infusion. You're going to press channel select, which will be B, and then go to guardrails drugs. We're going to click for alteplase. So we're going to page down because we're already in A. And we're going to click alteplase IR/OR. It'll come up with a variety of concentrations. Pick the concentration that your doctor orders. Usually we're normally in the 10 milligrams per 510 mLs, or the 10 milligrams per 1010 mLs. So we'll pick the 10 milligrams in 510. Click that. It will ask you, was this selected? Is this correct? You're going to put yes. Our clinical advisory always comes up because alteplase is one of those high alert drugs, and it tells you it's only for IR/OR. Press confirm. It tells you the drug amount, the diluent volume. It's not weight-based, so you're not going to put anything. The time units are per hour, and we're going to dose it milligrams per hour. I'm going to click next. You're going to click the dose. A lot of times it's either 0.5 or 1 milligram per hour. It's per your doctor's orders. So we'll click dose. We'll do 1 milligram per hour. And then I put the volume to be infused about 400 cc's. So it'll give ample notice when the bag is running low. And then you press start, and that starts the infusion. Thank you for listening.